We are live. So, good afternoon. It is July 30th, our Friday noon event from United Medical ACO. My name is Kemal Erkan. I'm the chairman of United Medical, and we are here to send give you our updates from the COVID and corona-related updates, news, and also we had some healthcare-related updates, and we are going to discuss those. While my business development teammate, Tanner, is going to be with me here today. So Tanner, you are back. Welcome back. So we are going to discuss the issues from a couple different points today. And I don't want to spend too much time in the beginning, so we can just go into the issues directly. The number updates we haven't done, we did, but we didn't spend too much time on the number updates, so we are going to go through those. And then while we are doing that, I just need to send a couple updates to the people who depend on my broadcast list. Let me just do that, Tanner.
No problem.
All right, so the issues that, other than the numbers and updates, the vaccine updates is going to be, and then digital health reminders is going to be also discussed. So before I go into the United States overall numbers, since this is a local Delaware event, I do want to share what's happening in the state of Delaware. Now, Tanner, you and I, we've been actually providing these updates. It's almost a full year now, right?
Mm-hmm. Yeah, correct. Maybe a little over a year at this point.
So the way that I'm seeing it, I think we got very comfortable to a point. We got our vaccines. Everyone got comfortable. And then even we stopped maybe paying attention to the numbers in terms of presenting those. But what's interesting that's happening these days is in Delaware, in a smaller scale, so the percentage of test positives. So right now, as of yesterday, we are at 3.3%. Now, this number, I'm going to take you from here and just look at where we were.
Yeah, just a few weeks ago.
So it was down to 1%, so I'm looking for 1% there. Okay. So that was June 28th. About a month ago, it was 1%. So percentage of test positive. So we went from 1 to 3.3%. That's a big jump. Now, this jump is also important because new positive cases are increasing. So we are at 78. And then if we were to look at the June, the way that we did, that time it was 19. So 4 times more cases and 3.3 times more higher positive cases. So this is happening even though with the vaccination and all that. So I do want to actually give this update for our people who live in Delaware. Current hospitalization, COVID-related, that's pretty steady. And I'm hoping that people can pay a little bit more attention. I think we got, again, it just comes down to people being more comfortable. Now, so when we did this, we stopped the animation here. So now we are trying to get to the 75% vaccination rate, and then now we're about 7 months away from that. That puts us into end of January, right?
And that's something that we've been keeping track of, as you mentioned, for months now, and have continued to watch it fall backwards and get further and further away from us, which is certainly concerning.
Yeah, so now what we want to do today is we want to discuss these issues and why it's happening, even the vaccination. why we are at that point. But we have, prior to that, we have some updates. So Tanner, I saw this where when you have a mixed, when we say mixed, we are not mixing them at the same time, but someone who has maybe 2 shots of Pfizer and they have the booster as AstraZeneca, they have a pretty strong efficacy.
Correct. Yeah. And this was something you had brought up. I found was pretty interesting. So doing a little more reading into it, my 2 takeaways on this, I think one are with the produced or higher produced T-cell responses from a Pfizer shot followed by an AstraZeneca shot. That level kind of mimics the one of 2 Pfizer shots. So that's going to be really helpful for areas and countries that might have a logistical burden on how many vaccines they can get of maybe a Pfizer. Maybe a 2-shot isn't necessarily available for everyone. So that is great news when it comes to actually being able to kind of bridge that gap logistically. And now the other thing I thought of too, my initial thought was, you may remember the AstraZeneca shot was one that was getting looked at for the possibility of blood clot relations to it. So there was certainly a little bit of a drop off there with the kind of how many people were actually coming in to get vaccinated or said that they would be willing to get vaccinated from that shot. So this kind of helps, in my opinion.
Do you remember that percentage of that, how ridiculously low that was?
Correct. That's a good point. It was 0.008% of cases in that study, which though, like we discussed, still created a hesitancy to get a vaccine. So I think being some of those people that still at this point might be hesitant, if they have the option to get that other shot, then I think that's great news.
So now I'm going to go back to the updates. So because one of the most maybe frequently discussed stuff right now is the Delta variant. So now with the Delta, why this is important, what makes it different than the others. Are you able to kind of get into that a little bit?
Sure. Yeah. So as we know, the coronavirus is certainly mutating, and that's why we're seeing some of these other variants that are coming about now. These mutations are happening. The more and more the virus is spreading, the more chances it has to actually mutate. So right now we're very concerned, or the most recent concern would be this Delta variant. So it's a little different from some of the past ones that we've seen. You can see here it's definitely a little faster when it comes to how easily it's transmitted. We're definitely seeing an increase in transmissibility for the virus with the Delta variant. But I think at the end of the day, what we really want to focus in on is the vaccine is proven to still continue to be the strong, most effective measure against this variant. So that is certainly going to be something we want to dive in a little deeper to, because there are a lot of, right now you're seeing Delta everywhere in the news, right? It's certainly increasing. There's been an uptick in cases that have been due to this variant, as it is the most prominent variant in the United States right now.
And the reason actually Delta becomes more problematic for certain population is unvaccinated population. And just looking at this graph here, this diagram, as it's rather like a higher share of the Delta, more vulnerable. And then these are the places where we have less vaccination rates. So now the other thing that I think the other important image that we shared with our providers, Anthony Anugu presented this for us, is the comparison of the change in new COVID cases in the last 4 weeks and the percent of population that is unvaccinated. If you look at the darker red and then match them with the darker red areas, it does kind of make sense, right?
Yeah, we're certainly seeing an overlay for these two graphs and when it comes to these metrics. So really the takeaway here is what we're visually seeing in areas and pockets of the country where the percent of the population that is unvaccinated is higher. We're seeing those are the areas where the hot spots are popping up right now. So as I mentioned, the Delta variant is, it accounts for roughly 80% of all new cases in the United States right now. And we're seeing that those areas that are unvaccinated are being the hotspots for where this virus is actually spreading currently.
So like, I think Florida is now kind of, they are, I think their governor is just announcing that they're gonna push the vaccination a little bit more.
Yeah.
As you can see, the new cases are increasing a lot more in there.
Florida is our hotspot. I did see that. I think that was last week. Governor DeSantis came out and started to kind of go back into the vaccination push. And we're seeing that in a handful of different places, not just Florida right now. A lot of like what you're highlighting right now, that Southern belt, we're seeing an increased presence with their vaccination pushes and efforts from some public officials there, which is certainly driven by these numbers.
Yeah. So now let's see. Now I think what I would like to do is, Tanner, if we can kind of discuss this issue in the terms of back to basics. So, I have a couple of signature terms that I use, like current situation and ideal state. The one that probably that you are not familiar yet is the back to basics. So back to basics is sometimes when we lose focus on the main issue, and then we kind of discuss the problem that came from the root, but then we are not discussing fixing the root of the problem, and we are just discussing different issues, and everyone's focus is in different places. Now, we are not going to, I don't think we need to force the vaccine to anyone. This should be something that should be received by people on their will. So, but the thing is, there are some responsibilities that we have to take. And what that is that understanding what vaccine does. So this is what I don't want to have. So let's try this. So we didn't, as our people know by now, that we don't rehearse these. So this is just happening now. And then, well, in fact, Tanner was out for the last 2 weeks from these events. So then we didn't discuss much these issues. So what I'm not happy with is how we are judging the vaccine and the result of those breakthrough cases, and then saying that, oh, see that someone is vaccinated and then they have positive COVID. Well, and that's because we kind of forget what we were told with the vaccines. So what we prep for you is just to kind of understand the vaccines they all come with the efficacy and how effective they are. And then none of the vaccines ever is 100%.
Right. Correct.
They don't have 100% efficacy, right, Tanner? So this is one main issue that we have to kind of understand. So if let's look at the COVID, I mean the COVID vaccine, like specifically what it does. Like this, you actually put this together for us. So you are saying that regular flu here, right? This is 44%.
Correct. Yeah, and I thought that this was really good because one thing I personally hear quite a bit is the comparison with the COVID vaccine as it relates to the effectiveness or of some of the other ones that are pretty routine and standard for us at this point. And going back to the efficacy and the effectiveness is really showing us in a real world situation, how is this vaccine playing out and how protective is it against illness, symptoms, and severe cases of COVID. So when we think of certain vaccines that we're getting pretty regularly as a society, the first one I comes to mind is the flu. So I was interested to see exactly how effective the flu is, and at the same time, seeing that it is just about 44% effective here in the United States in a real world scenario, in a real case scenario. then the 95%, the 94% that we see with these vaccines as it's played out is quite significantly more protective. And I think that that's very important.
No, absolutely. Now, then with understanding of this, now we can easily say, I mean, these studies do have their own limitations, right? So
Correct, yeah.
With those limitations, when do all kids have this vaccination in the United States?
Yeah, I believe so. So I was reading through some of the other one. I think that that's why they included this one here.
It's 92%.
Right.
So like 8 out of 100 kids may still get it after they are vaccinated for chickenpox.
Mm-hmm.
So now we have.
Mm-hmm.
Go ahead.
So I just wanted to say, like, to your point, yeah, this is something that we still, of course, even though we're regularly inoculating against chickenpox, you'll still have cases, in which case you could obviously say that they're breakthrough cases, similar with the flu, but I don't think that those, at the same time, we're still year after year getting our flu shot, and we're still giving chickenpox shots out. Just because there are those breakthrough cases doesn't mean we're stopping these efforts. I think that's important.
Yeah. So with the Moderna and Pfizer, they're being averaging at 94.5. This is the highest we ever have in a very short amount of time, and that's where we are. So not to take this, now I take my flu vaccine every year and I still get the flu, but I think the severity of the flu is a little bit less every year. But this is something that is not going to be, I cannot ignore this easily. So that's important. So I think we need to make this clear so that when we hear from other people that, oh, well, I don't want to do the vaccine because, see, the person who's vaccinated is positive. Well, we knew that was going to happen because we are given these numbers already. 1 out of 20 would be positive. The issue is you would be replacing that with 20 out of 20 rather than 1 out of 20. So that's what the vaccine is doing. Now, the other thing is understanding how this vaccine is working. And, I'm not going to be, both Tanner and myself, we are not clinical people, but we are in the clinical world. And I've been almost 20 years doing this and hearing it all day long. But we are able to educate ourselves, understanding why this is one part of the efficacy is important. But the other part of the issue is how this virus is becoming different with the mutations and what happens when that happens and why certain variants are more important than the others. So, Tanner, I want to kind of spend a little bit of time on that. So we have this breakthrough COVID-19 infection after vaccination from Israel. This study does give some information, but what I really want to go to is if we can do this, let's see, and then we can come back to that guy after. Here, what happens here is when, okay, I'm going to come back to this. So when the virus itself is infectious and it just spreads around, then we expect that to mutate, and then it goes, and then at some point it takes a different variant. And that variant it becomes a concern if the infectious speed of the infection is faster than the original one. So that's what the Delta is today, right? So it comes from the COVID-19 coronavirus, but now it's faster spread. So then how it's going to reach out to more people is faster. Now, we have to explain these and we have to listen to each other, and then we have to make our decisions. And I do not believe that we can force anyone, and I don't think we should. But I think understanding part is important, and everyone is at least obligated to the society that we live in to put enough efforts to understand why we have to do something about this. And that something is from the graph that I'm about to share, this infectious, as the spread goes around and it happens, the chances of having another variant is going to be high. That's kind of like, how we were discussing yesterday, Tanner, like what would be the right way to say it is that like the chances of getting another variant is really depending on how fast this is going to spread around. So on this left side of the diagram, where we have only some people are vaccinated, you still have these red figures here are the not vaccinated contagious people, and the blue ones are the healthy, not vaccinated people. So when what would happen when those people would become sick, chances are that's what's going to happen. So then the spread is still happening, and then it's happening everywhere. But if we are able to get more people vaccinated, the yellow ones here, and if there's one person sick here, and then there are three blues, right? So that three blue would maybe it's going to go down to 2 because it's kind of like we are able to isolate that issue where spread is not happening, and then there's the chances of another variant is not going to be the case. So that's what the main issue is. Now, how are we able to say this in different terms? That I don't know. But I'm going to go back to our study that, if we can just summarize this guy here. So Tanner, this was you, right?
Yeah. So I just kind of from my thought too, Kamal, with what that graph was showing, I think that's really important to note that, as you mentioned, really we're seeing these variants come out because as the more and more the virus is being spread or being transmitted, it gives more opportunity. I think opportunity and the possibility is the important thing here, right? So the more hosts that the virus takes on, the probability of another variant is higher. And the idea of the vaccine is to, one, reduce your chance of getting the virus, but two, of course, as we mentioned, it's not 100%. You won't get some sort of symptom. You won't have COVID symptoms or experiences, but it reduces your viral load, which is the really important thing. And the less viral load you have, the less of a chance you're going to actually be able to, or you will spread, or less chance you would actually spread it to another host. So it's all about reducing the chances of the virus actually being able to spread to eventually get to that herd immunity, which is important. So yeah, some of the stuff that other points that I was taking a look into and reading about were some of the concerns that people still have. And we have some good information now as to why people are still hesitant. And now we really have some good information and good data at this point that we can kind of help to use to address these concerns. And some of the stuff that's just important to remember is what we've just been discussing pretty much today, what Kamal and I are talking about is, even though you get the vaccine, you of course still have the chance to get the virus. But what's important to remember is you're much less likely to have severe or serious reactions to it. So less likely to catch it in the first place, and then therefore less likely to spread, which is what I was mentioning. So although not 100%, the reality is the takeaway is that the vaccine reduces the chances of symptomatic disease for yourself, but also for the chance to you to spread symptomatic disease to others. And that kind of ties right back into your point, Kamal, where, well, of course, we don't want to say or come out and be like, well, we're forcing this onto anyone, but rather we, in the clinical field, not being clinicians ourselves, but being around it all day long, we hear it from our physicians and we hear it from our doctors that we work with, and it's our responsibility to make sure we're educating ourselves and we have the best information to make the right choice for ourselves that is ultimately going to affect ourselves and our communities.
So, another image that we have that we borrow from Anthony is from our law site. Actually, it was kind of interesting. It's a good comparison, Delaware versus United States, for different group of people holding us back from vaccination. So I want to share that with the audience.
Yeah,
so,
I thought this was interesting.
Right, so it was kind of, I didn't find some of these funny stuff. You find them later. So in Delaware, there are 17% are the watchful. They are waiting to see what happens. In the United States, that's 8%. So they can. This is 5% the co-sanctions, so they are 9% in U.S. So I don't know what why it would be.
My first thought with that, Kemal, too, I was a little confused considering that the vaccine is free to the patient. There is no administrative cost there on the patient end. This could be related to more so having the ability to get to some of these places. And it's one of those determinants of health that I know we focus on with our practices. It could be transportation issues, possibly with the cost. It could be just not being able to get off work and have the time to go. Although at this point, again, because it is so readily available, that's where I thought that might be coming from.
So, but again, it's free, right? So
correct. I think that's important.
Our primary care offices and our surgery center, we provided this at no charge to the patient. So there are system distrusters. That's 2% versus 4%. Delaware is more kind of on the Democrat side. I guess maybe that's why we trust the system a little bit more. But overall, the country is at 4% don't trust the system. And the Spectix is like 13%, 14%. That's interesting. That's about the same.
Yeah.
Now, I don't know what's behind this study and who did it. And well, I didn't do it for sure. But I thought it was kind of interesting who holds us back. Then, it's...
if I'm not mistaken, I think it's coming from, there's a really good study from the Kaiser Family Foundation that goes into all kinds of different reasons that are being provided through surveys on as to why people are still hesitant for vaccine at this point. It breaks it down into some demographics and reasons as well. So at this point, we have a lot of interesting data on that.
Definitely. So our next update is the plan for the federal workers to get vaccinated. This is from the Biden administration. I don't know if this is already, this started this weekend. I don't know if it's already in place. There are mixed feelings and how people are going to be vaccinated against their will. What would happen to those employees if they don't want to do it? If they're going to be tested every week? Now, actually, ChristianaCare, one of the hospitals in Delaware, is mandating. Outside of that, there are others, like New York is mandating for their employees, state employees. Apple is doing the same thing. I don't know why we have Netflix, but Netflix is Citigroup. So I think this is going to become a challenge. When we mandate it, I personally do not support the mandate. I support the vaccination, but I do not support the mandate. So if someone doesn't want to do it, the only thing that I don't know what the solution is. So usually I tell people if they don't want to do something, they need to give us a solution. So in this case, I'm one of those people now. I'm saying that I don't believe in this mandate, but I also don't know what the solution would be, because we don't know whether or not, we don't know everything. We're not going to say that we are, 100%. None of these things are 100%, but we know that there is science, and science, well, you either believe in science or not. My 80-year-old father, he got his third dose, and he couldn't wait to get his first one. He couldn't get his second one. And when the third one was up, he was one of the first. Because of his age, he was able to get it first. And he didn't have any problem getting it because he believes in science. If the people don't believe in, then difficult to change their minds. So then instead of fighting and creating a system issue or the society issue, I think we need to figure out how to make this possible. Now, I don't want to wear a mask if I don't have to. Traveling is so hectic. After vaccinated, I had COVID. Now, for those who don't believe in COVID, that's well, I have news for you. So there is COVID. I was one of the first ones in April 2020. Probably worst pain I went through. I was home for about 10 days. No smell, no nothing, almost big muscle ache, couldn't get up. Was able to do our provider meetings every day, and most providers didn't know that I had it, but that was only for 1 hour. The rest of the day I was sleeping. I was actually laying down, not sleeping. So COVID is real, and we have ways of fighting with this. And can we actually make this team effort, community effort? I think we can. I do want to make sure that this becomes less problematic for the people that we work with and people that we live with. And I'm hoping that that would be the case. Now, so we have a couple events are happening now for our patients. If you are a patient of United Medical ACO, any of the practices doesn't matter. So we have the support group started, and this is going to be happening. Next one is going to happen on August 25th. We had one on July 28th. So we are going to have once a month. The only thing is, this is an exclusive event, and it's only for our patients. So we are not posting this publicly. Well, we are posting the event news publicly, but the link is not being shared. So you should be getting an email from us. If not, please ask your primary care to let you know about the event. And then we have good discussions. Right now, there are no, what I heard that there are no group support groups happening for diabetes. And we are doing one of those. And hopefully there will be more people joining, more patients who can take advantage of those. And the events that we are doing, they are being posted on our YouTube channels. Please follow us through those. And just like this event will be shared there. So, Tanner, you missed one of the events that we had with Senator Sarah McBride.
Yeah.
I think that was one of the, I'm going to say that I think I enjoyed that one the most.
Yeah, I think it went really well. I was sad to miss it, but I did get to catch up on it afterwards, and I think that it was a really good discussion.
So, I think I do want to bring her again back at some point to discuss some of the other healthcare-related issues. I think she's a great speaker. I think she's very well focused on the issues that we have. Now, we just find out that actually she's going to be the co-chair of the annual breakfast for YWCA. That's
I saw that.
One of the organizations that United Medical supports. They're one of the main sponsors, I believe. And she's going to be the co-chair there. So, but I think that was a really good event, and we are getting a lot of good reactions from people. And you did reach out to some of our Republican senators and in the state, and then they have not come back to us yet.
If they're listening.
I'm an independent, so I'm not on one or the other side, and I can say this in public, so then Anne doesn't judge me. So I'm an independent. So, and this is open for all the people, but somehow you emailed them twice and they didn't come back to you. On the Democrat side, you didn't have to chase them down too much, so they respond back to you and then they just tell you when they are available. So I think the state Republicans need to shape up their game, and maybe they can come and talk to us, and then we can ask some questions for them, and we can definitely make them part of this event. Well, Tanner, did we miss anything? So I think that's all we have for today.
Yeah, I don't think so. I think that, well, first of all, I'm glad to be back. I think that this was an important topic that, especially with everything that's going on in the news, I know it's swirling around in everyone. It's impossible to miss Delta variant, or I think it's important, as you mentioned early on, that we keep these conversations and make sure we understand the importance and the impact of our decisions when it comes to the vaccine with others. So I hope anyone who was able to tune in today, got something out of this. And as always, when it comes to any of these decisions, of course, we encourage you to reach out to your primary care physician, talk with your doctor, and look for some of those clinical information sites where you'll be able to make the best decision for yourself and your community.
Thank you so much, Dan, for joining me, and we'll see you next week. Today we have another event, most likely that's going to happen at 1 p.m. Got a message from Dr. Erkan writing operator notes and leaving St. Francis shortly, so we should be on time. But our goal is to be there at 1 p.m. For our Bariatric Friday. If we are maybe a couple minutes late, that may be happening, but we'll be there. We'll see you soon.